Welcome everyone to this event run by FIP, Vaccines and Special Risk Groups, pharmacy teams and all healthcare workers. We are now welcoming our participants. You know that we have a short delay here. We have roughly 350 members who have registered for this event, so we take us some time just to welcome all of them. So again, I ask you just wait for a few more seconds until we welcome all participants. I'm also seeing here on the chat group that a lot of people are sending regards. We have a very eclectic participation, people from all over the world, which is very good. Thank you for taking the time of your daytime just to be around. And while you just welcome everyone, just go through a couple of housekeeping rules. We have this webinar being recorded and live streamed on YouTube, so feel free to look at it afterwards. Then you can also access it on the events page of FIP. You have, in case you want to raise a question, there's a specific box here on Zoom. You can do it in the Q&A. And of course, you are welcome to give some feedback, not only about this event, but for others, or what you want to see being run by FIP, and you feel free to do it on this webinar at fip.org email address. And of course, you always welcome everyone, those who haven't registered yet as a member of FIP, to become a member of the FIP team. So my name is Luis Lourenço. I'm currently the FIP Professional Secretary. I'm a community pharmacist. I come from Portugal. It is my pleasure to introduce everyone who will be part of this event. You can see that on our next slide. You have here representatives from different constituencies within FIP that focus with practice. We have different sections. We also have the pharmacy technicians advisory group representative. We have Susan here, Ryan from hospital section, Jerry from the military and emergency pharmacy section. We have also Nancy from academia section, and then Safi from the early career pharmacist group, Jamia Costa Gomez from the community pharmacy section, Felipe Alves da Costa from SAPS, from the social ministry pharmacy section, Solarin from the industrial pharmacy section, and then also a member of our team, of our headquarters team, Ruben Viegas, the practice development and transformation projects coordinator of FIP. Unfortunately, due to conflicted events on the agenda of the representatives of AMISH, the Health and Medicines Information section, and also from CBS, the Clinical Biology section, unfortunately, we were not able to have them on board on this event. They send regards to everyone, but I'm sure that the participants that are part of this section or that work in these particular areas of practice will find some guidance and some ideas for their own practice from the feedback of all the rest of the participants. And then you can see on our next slide what is our plan for today. So a short introduction by myself, then I'll give the floor to Ruben to speak about the vaccination needs and benefits for healthcare professionals. And then we have a debate with all our members from the different constituencies, as I mentioned to you, of FIP focusing on practice. We hope also to count with your participation as a member of this event to raise some questions, even the hardest ones. And for the due, I have here a couple of informations or learning objectives that's part of our introduction. The idea is to, at the end of this event, to understand the most important vaccines for healthcare professionals, including pharmacists and pharmacy teams members, and understand also the roles that healthcare professionals play in building vaccines confidence by being vaccinated themselves, being those leading by example. We all know that can be very difficult sometimes to convince all our team members to do it. And of course, also to discuss strategies for pharmacists to engage in vaccination campaigns for pharmacy teams and other healthcare professionals. So with no further ado, I'll just give the floor to Ruben, the Practice Development and Transformation Projects Coordinator of FIP, who will share some words about what is being going on FIP on this regard. Ruben, the floor is yours. Thank you.
Thank you so much, Luis, for the kind introduction, and welcome everyone, and also for the ones watching the recording later. So I'll just start the presentation with a high level overview that FIP has been working on vaccination for probably over a decade now, and it only became more important with the COVID-19 pandemic. So it's important that in this series that we're doing, the special risk groups that I'll present in a minute, that we're highlighting and focusing also on the work done by WHO and UNICEF, for example, highlighting the Immunization Agenda 2030, so the goals in vaccination for the next decade, or the relevant guide, that is the implementation guide for vaccination of health workers. So this is a topic that is quite relevant, not only in the organizations themselves, but also if you look at the research, there's quite a lot of research in this area, reviews of vaccination, also the barriers and motivators for healthcare professionals vaccination. Of course, a lot of is focusing on COVID-19, but there's also influenza and other vaccines that that got this attention from the academia and the research side. So regarding this series, you'll see that we focus on different risk groups before, so cardiovascular, chronic respiratory diseases, older adults, people living with diabetes, pregnancy. We also did a roundtable summit where we discussed this with the different stakeholders, and all of these are available in the FIP digital events website. So you can visit all of these events. We also have very short videos. So these are 2-3 minute videos that also highlight the main vaccines for each of the groups. This is a way, but people that cannot spend the whole webinar and go back. So this is like a capsule, combined information. And we have this for the other videos. And today we're launching one, and like to thank Catherine Duggan, CEO of FIP, for recording this message for the colleagues. So this will be live in the FIP social media. And you can see, for example, it has a list of the most important vaccines. Of course, this depends on the setting, as we'll explore later, and also sometimes highlighted key messages from the already short message. Then on this group, we also have a toolkit that was published last year that has this information for the six groups. You can access through the QR code or the link on the slide. And you can see that the last group is healthcare professionals and workers. So this is indeed the last event of this series, but it's not the least. So we also need to discuss this important topic. And the toolkit very briefly has like an introduction and a summary table, some recommendations for the main vaccines. Of course, this differs from country to country and region to region, so it's not exactly the same everywhere, but the main ones are there presented. And then inside of each group, we have a small part saying what makes this group vulnerable, the recommended vaccines specific for the group, some key messages and additional information, or other websites that already have a lot of resources for this specific group. So these, for example, are some screenshots of the healthcare professionals and workers. So a small introduction, then the main vaccines and why they're important for healthcare professionals and workers to have them. Of course, they're contagious diseases. It's more than obvious that you should try to be vaccinated so you cannot pass these diseases to other people. But there's also the question of hesitancy. So there's quite some messages in this toolkit. And all this information is available on the prevention microsite. So it's a website that you can also access on the QR code. It's prevention.fip.org, and you have a full tab for vaccination and all the resources, all the publications and events. So it's separated by area. So if you're interested in the area of vaccination, you can go to this page directly, and you'll have the different resources and also the special risk groups series. It's all in here. And I think that's it, Luis. I'll save some time for the discussion. I think that will be the most important part, but I just wanted to give this overview to everyone. Thank you so much.
Thank you, Ruben, for, in a nutshell, just summarize a lot of work that's being done by FIP, not only on creation of publications, of reference of a lot of documents that's been published by our partners, by WHO and other relevant partners related with vaccination. And I'm very much looking forward to see Catherine's video on the release for today. So I invite all of you also to be aware of the social media and the regular communication from FIP, just to have a look and the video. And again, thank you so much for your time, for sharing all this information. So we move forward with the second part of our event, and I'll give just a short introduction of all the members that have been invited for. So on behalf of the community pharmacy section, we have with us today Mr. Jaime Acosta Gomez, who's currently the professional secretary of the section. Then we have from the hospital pharmacy section, our dear friend Ryan Forey, also the president of the FIP section. And then we have from the social and immunity pharmacy section, my dear friend Filipe Alves da Costa, also our dear vice president of the section. And then we have Sola Solaris, the president of the industrial pharmacy sections. Our colleagues that are actually here working hard just to have the vaccinations ready for all of us, or for some of us, to administrate and to counsel. And then we have also Jerry Z, a representative from the AFIP section, the medical and emergency constituency within the Board of Pharmaceutical Practice. And then Mansi Doshi from the academic pharmacy section, executive committee member. And last but definitely not least, oh no, sorry, you still have Susan, sorry, Susan, my dear friend Susan, who's leading the Pharmacy Technicians Advisory Committee, who has done an amazing job. We give us also here perspective on our colleagues on the healthcare team, the pharmacy technicians. And then we have, as I was saying, last but definitely not least, Safi Sagensel, the FIP Early Career Pharmaceutical Group. Sorry, a while ago I said pharmacy. I'm still very, very much used to the old acronym of this constituency within FIP, the Early Career Pharmaceutical Group of FIP. So she also shares some thoughts on this topic. And so I invite all of this of our colleagues just to switch on their cameras so we can actually see them. So thank you. They're being around. So I would start with a question to all of you, and I will also like to remember our participants that they are free to send their questions or regards or anything that you find relevant on the Q&A box at the bottom part of the Zoom link. So I will start with this question. So how relevant do you think, from your perspective, vaccination of pharmacy workforce in our practice setting is, how important it is, and why it is important? So I might just start with Jaime, community pharmacist. Hi, Jaime, how are you doing? The floor is yours.
Thank you for the invitation. So, well, it's a pleasure and honor to be here representing community pharmacists, which is not only the biggest part of our beautiful profession in terms of volume, I would say also in quality, but I won't say that. Sorry for that, it's a joke. But we are very much very close to patients, and it's I think it's our ultimate duty to care for our patients in many senses. Especially, of course, providing safe care to them. That means not harming them. And that's why the first reason of the relevance of being vaccinated. We have to care people at the utmost, as much as we can do. And that means for me, of course, and for most of our colleagues, to be vaccinated. That's the first thing. Second thing is to protect the service that we are running. I was remembering the hardest times of COVID, and we were so eager to be vaccinated to be able to provide a safe and continuous service to our patients when everything was at stake. Community pharmacy responded, also because we were super happy to be vaccinated, also providing an example to our patients, which is the most important message. I don't believe in leading by saying. I believe in leading by doing, and the best example that we can give is being vaccinated ourselves. My team and I were very happy to post on social media our pictures being vaccinated for COVID, and I think that provided our patients with a sense of relief. And I think it was very, very important in that time. We received many messages, and that's something that many colleagues did at the same time, sharing their not only proper, solid information, which is very, very important, of course, but also their example. And lastly, I would just comment to give room to other speakers, the importance of protecting ourselves and our families, which is, of course, basic too. So yeah, I think as healthcare professionals, we really need to be vaccinated. That's very important. Thank you.
Thank you, Jaime. So you give the perspective from the community pharmacists that are working on their own communities when they are exposed to a lot of people. So in a way, they are also leading by example, which is important. But just let us think a little bit about in a different practice area. Ryan, you work in a hospital, you have colleagues working in different departments, being exposed to different kind of patients. Are there specific issues that are being raised by hospital pharmacists? How do you see this importance of vaccination with the practice is also very variable depending on where you are working?
Yeah, I would say with pharmacy in particular, there's a high amount of variability in the types of roles and patient exposures that you have. So it is easy for some people who say, I work in a pharmacy that's in a basement of a hospital, I never come in contact, to try to get out of having vaccination requirements if we're thinking about like influenza, if we're thinking about COVID, or even as we start to talk about newer vaccines like RSV. But realizing that we're all in the same patient care area, there are interactions that are impossible to avoid, and helping people realize how interconnected what you may do, on night shift in a pharmacy clean room as you're compounding a dose, ultimately that you potentially will impact the other patients and other healthcare workers within that facility. So really driving home those messages of the interconnected nature of healthcare workers and the provision within the hospital. And again, going back to Jaime's point, the importance of the patient. I will say, at least from the United States perspective, many hospitals have long mandated different types of vaccines, whether it be an annual influenza or some of the preventative vaccines that you see, like hepatitis B, based on bloodborne pathogen exposures. And so, that's a good base to start from. But anytime you get a new vaccine, it reignites the conversations about whether people need to have them, what are their rights as an individual versus the rights of the healthcare worker community and the patient to be protected from these diseases. And so I think that's where just reinforcing the same messages and to the point, being out there as an example, especially as the leaders within a department of pharmacy or the leaders within medication management and handling in the hospital, being out in the forefront, showing people that you're willing to get it. I know, for example, when COVID vaccines first started rolling out in December of 2020, it seems like about 10 years ago, I had to think back to the date, some of the very first images that were on TV were from hospitals of healthcare workers, at least in the US, getting their vaccinations, because with the limited supply, it was being run through the hospitals to the highest risk, population, the people who need to care for those patients. And so I think those types of activities help reinforce it. The challenge becomes now, as we get further away from the emergency, as we get further away from the critical nature of COVID, how do you keep people interested in getting the vaccinations? And I think that's a good question, because we see it even with the latest boosters for COVID. The uptake for those is very, very low, especially in comparison to the original vaccine. So that's now the challenge I think we have to balance, as everyone has a little bit of this fatigue from vaccination.
Thank you, Ryan. Interesting topics. I think all of us are going through worldwide facing the same issue or something similar. The emergency of COVID is not perceived the same way, and also the perception of our communities just to get vaccinated. And I'm just curious, because we've just gone through this pandemic, although it hasn't been over according to WHO, but we are seeing more and more events or situations, and you need to have some emergency aid, and we have more volunteers also available to get involved in those events. So Jerry, I'll just would like to give the floor to you and ask for your perspective. Of course, you also represent within MAPS the militaries, and you know militaries can be very strict. So as a side note, I once was having a word with one of the members of MAPS, and she was saying that she had no problems with the medication adherence, and she showed me the gun. So of course I wouldn't do that, but jokes aside, Jerry, we are seeing more catastrophes. You're seeing people being deployed from one area to the others, where the emergency of healthcare issues are different. What's the perspective from MAPS, from your own experience as well? Are we aware as professionals that you need to have this understanding of where we're going? Are we all well informed? Just share some thoughts with us, please. Thank you.
Absolutely. And it's great to be here. Thank you for having me to represent MAPS. So it is very, very relevant for the pharmacy workforce who wears the uniform, like myself, to not only provide the vaccination care in the practice settings, but be vaccinated ourselves, right? So it is an essential part of the pharmacy services that the pharmacy team provides to those that wears the uniform, the public, as well as refugees and migrants. For example, for the U.S. Public Health Service Commission Corps, we are often deployed to natural disaster areas, emergencies, epidemics, pandemics. Many of these type of situations are actually in austere environments where the infrastructure and even patient populations are definitely unpredictable. So definitely the force protection of utmost importance to keep our pharmacy workforce be safe, be healthy, and that we're able to fulfill our mission requirements. So a case in point, the US extracted tens of thousands of Afghan refugees in the summer of 2021. Many of them were flown into the US and landed on military bases across the country without much vaccination or health paperwork. It's totally understandable since they barely escaped with their lives. And so we don't know what their vaccination status would be, if any, while living in Afghanistan. So many of my colleagues, pharmacy officers from the U.S. Public Health Service Commission Corps, were deployed for the specific task of providing pharmacy care and vaccinations care to this population without knowing what kind of exposure that we will be subjecting ourselves to care for this population. So this is, I would say, quite similar in our disaster response missions, where patients' lives are upended and suddenly dropped into our care. So oftentimes deployment folks like myself do not have the extra personnel to fill in if anyone becomes sick. So, and obviously we don't want anyone to be sick. And so vaccines definitely help our caregivers so that we can continue to protect, promote, and advance the health and safety of, I would say, not just my country, the US, but I would say folks across the world. Thank you.
Thank you. Thank you so much, Jerry. Filipa, I was going to ask you for your experience. SAPS works a lot on pharmacoeconomics, health economics, also a lot of research. From your own experience and from the experience of the members of SAPS, vaccination is utmost important, but we know that we have some idiosyncrasies. So what can SAPS in a way, or what can all that information in a way, how can be used just to help us promoting more vaccination amongst our profession?
Thank you, Luis. Yes, indeed, SAPS represents pharmacists working in various areas of practice, so community, hospital, regulatory science, academics, research, all of that. And I guess the thing that all of these people have in common is the extreme focus on the evaluation of evidence. And I believe this is very central, because in many of the discourse we hear, when we think, why are we discussing if pharmacists should be vaccinated? I mean, it should be quite obvious. And I was hoping that we wouldn't get into a discussion of which area is more relevant to vaccinate, and happily we're not getting there, at least so far, because in fact, all areas are important. And the main reason is because vaccines are probably, and I would say definitely, the most effective public health intervention that has been ever developed. So if we have this intervention available to us, there is no reason why we shouldn't take it, except for exigency. And of course, it is the role of pharmacists, but also pharmaceutical scientists, to promote more knowledge about what do vaccines do. And sometimes we hear a lot the belief that people expect vaccines to protect them, like, I'm vaccinated, I'm not getting the disease. And that's really a wrong perception that people have. And the reason why we're getting vaccines is so that we don't have the most negative outcomes of vaccines. And the reason why we put healthcare professionals as first line is because if they're not there, people cannot be treated. It's not because they're seeing patients and they cannot transmit. It's because if they are not vaccinated, there will be losses in productivity, of course, and in work absenteeisms, and with all the impact that this will have on the patients that will not receive care. So I think, I mean, pharmacists are a role model, or they should be, at least according to FIP's competency frameworks that have been developed recently. And in all areas of practice, they should be a role model. So some of the colleagues have already mentioned this. So I believe in all areas, you have to give the example and show people that there is enough evidence to support the uptake of vaccination. The risks are extremely, extremely low, and the benefits are very clear, and there's enough evidence by now.
Thank you, Philip. Just very interesting issue, although we are focusing here on practice. You just mentioned the science that's in a way supports our practice, which is essential, which actually is also the cornerstone of FIP, who has a focus on practice, science, and education in a way that we need to rely on the data that we have to also to guide us on our practice. And speaking about education, Mansi, so academics, they are essential also not only to give the basics of pharmaceutical sciences for all of pharmacists and also to other healthcare professionals. How do you see this perspective? There's been a lot of discussion about hesitancy, about non-vaccination or no vaccination groups. How do you see that from the academic point of view? Do you see that raising amongst students? Is there something that has been discussed within your peers?
Thank you for that question, Louise, and thank you for this invite. I would like to say that vaccination in workplace is not mandatory in many countries, and that is even for practicing pharmacists. And certain countries do not even have occupational health guidance to indicate vaccination for practicing health professionals. India is no different. And taking a step backward, the COVID-19 pandemic obviously for the first time led the government to identify and acknowledge pharmacists as health professionals in India, which led to vaccination for COVID-19 early on with other health professionals. When I speak about the academic side of it, I am a teacher practitioner per se, so falling within the health professional group, I got myself vaccinated, but if we go to practice or in any workplace, my vaccination status has never been questioned before COVID. And nobody has ever asked me whether I was vaccinated for the obvious vaccinations and immunizations. As an academic pharmacist, I would like to say that the first thing that we also happened was that universities and schools closed down. And when they reopened, the big question was when and why and what would be the vaccination and immunization status, whether it was appropriate to do so or not. I would like to say that the risk assessment, the occupational health risk assessment may be variable for an academic to be vaccinated or not, but it does not necessarily mean that there is going to be no direct or indirect contact, patient contact, like it was mentioned by some of my colleagues here, that it is not practice specific only. We will certainly, as academics, have direct or indirect contact with patients and the public when it comes to research, education, as well as training. So the relevance of vaccination is not restricted to practice. The significance may be variable based on the occupational health risk that it would carry, based on which vaccinations we are looking at, but we cannot avoid being vaccinated as pharmacists and pharmacy academics only. Number of us actually go back to practice, not just clinically, but also in industry, and there is significant exposure and going between university and practice and work areas. It is equally important that as a health professional, all pharmacists are vaccinated, and there should be appropriate guidance. So leading by example, I would say vaccination of pharmacy tutors and institutional requirements should be integrated for pharmacy students as well to be vaccinated. And this should encourage probably a mixed policy, which would have mandatory vaccines as well as voluntary ones. And this mixed policy would be slightly variable when we are looking at different workplaces that we speak of for pharmacists or other health professionals. Thank you.
Thank you so much. Very interesting perspective. Also, we have here a diversity of practice areas, but also diversity of countries. So we all know that we are a very diverse world. It's also very interesting to see the perspective or the national perspective about this issue. So it just raised my mind, Sola, all the industrial pharmacists are being very active. They were we were all very worried about the fact that industry had to keep on working, especially in COVID, for the vaccines production and I think that probably in the last couple of decades, there has never been that many discussion about the production of vaccines or the area of industrial pharmacy. However, our colleagues are essential not only to supervise the production and to all the technical issues related with that, but also just to as a sort of role models. As a role model for all other professionals. So what's your perspective about this? Is that something that's very on the top of the mind of our colleagues that are working in the industry? We know that in most of the cases, they are not dealing with patients. Are they aware that they are also leaders and they can actually influence the issue of vaccination?
Yeah, certainly. Talking about influence, don't forget industrial pharmacists are very much involved in generating documentation to prove safety and efficacy, not just to the healthcare profession, healthcare practitioners generally, but also to regulators, and in some instances also to patients. We are also involved in developing the vaccines. We're also involved in industrial production. So this brings to question, the philosophical angle to this question, okay? If you make this make sense, if you communicate to regulators and to end users that they are safe and they're effective, can you, in good conscience, refuse to take the vaccine? Will it be fair? Okay, so for us as industrial pharmacists, I think, we can't stand before anybody and say, for any reason, we can't take vaccines, okay? It is for us proof of quality, because one of the definitions of quality really is that if you know the provenance or the history of a drug and you can use it on yourself, you are making it clear to others, who you are trying to convince to use it, that is of good quality. So that is one leg of it. The other leg of it, like I said, is the fairness of it. Okay, can you industrially produce a product that you don't believe, is of good quality and will work. And lastly, and this has been mentioned by one or two people, we have to serve as role models. We have to serve as good example. And who else can do that than somebody who knows the history of a product, both from its, tests at the experimental stage to, clinical trials to industrial production than, the industrial pharmacist who has produced it. So it's not a question we belabor ourselves about. It is only fair that we are vaccinated. Thank you very much.
Thank you, Solo. Interesting issues. So if our colleagues do not trust what they are producing, how can we trust them? So this role, this really important role to be in a way motivated within the profession just for the support of vaccination. Thank you. You also rose a very interesting point, which I'm thankful for having done that, because I don't have to say I was the one who was raising it, is that this idea of a mandatory or incentive-driven vaccination. And Susan, I give this hot potato to you. So how do you see that? Do you think this will be part of the solution, just to force people one way or the other to have their vaccines, either population, pharmacists? What can you say about this from your own experience?
Thanks so much, and thank you for having me here. I guess just to start even with saying, as I'm here representing what is the pharmacy technician and the full support workforce, that recognition that these individuals are key and core to the team and need to be treated very much as a member of the team. And so certainly all of the different environments, the reasons that people have talked about why pharmacists need to consider to be vaccinated from the role model perspective, from that of vulnerability and the important role that they play in sustaining that workforce and the activity that needs to happen. That all is true for pharmacy technicians and the support workforce wherever they are. And so it is really a question that is for the entire team more than likely. And this question of mandating is a very, very difficult, as you say, hot potato ethical dilemma. And we saw that play out significantly throughout the pandemic. I am a regulator as well of clinical practice for pharmacists and pharmacy technicians. And so this was a very difficult challenge for us throughout the pandemic and in other times in terms of whether or not to require individuals to do this. I think that there is no one answer. Obviously, as has been raised, we are working in such diverse areas throughout the world, and the political, social environments, healthcare is delivered so differently that there isn't any answer that is going to suffice in terms of how to mandate this for everybody. In our particular environment, to the extent that we are not needed to mandate, that people are still able to have that free will to choose, that is certainly preferred for pharmacy, and people have talked about this. There is that sense and certainly a desire that within the profession there is the recognition of the value, and that in some ways much more helpful as a role model if you have by free will chosen to take this vaccination than being required to do so, because for those that are looking to you, there is greater trust and sense of confidence that you have freely put your hand up and stepped forward, and that is based on the evidence, the confidence you have in that. And I think that holds true certainly for the pharmacy support workforce. I would just say that this part of the team is actually a very interesting one, and a couple key points on mandating. One is to hopefully make sure that they have the same access, and if there is a mandate for a need to do that this group is equally considered. As I said, for the same reasons, they are equally vulnerable, and they are equally important in terms of maintaining services. So we would hope that they are treated the same in that regard. I would also say, though, that they're an interesting group in that they are sort of that next level, perhaps, audience, if you will, for the profession, for pharmacists, and those to be able to help this group that doesn't have the same level of understanding the science, the background, the evidence. So it's that next level of helping to educate and inform and make sure that this group is understanding and able to acknowledge and accept the value of this. So it's sort of, teaching the students in that sense. They might be considered in that same way. And I think that they play a very important role in that people will be watching for that. These are a group that patients will believe that they are making their choices differently, and that patients may believe that pharmacists, physicians, some of the other team members, of course, they're going to do it. They're expected to do it. They are a kind of a health professional that's going to do that. And there's a little bit of hesitancy sometimes, but, would they still choose it if they didn't have this sense of responsibility as a professional? And so I think for the pharmacy support workforce, you will have patients who will turn to that group and ask the question, so what about you? Maybe you're not required to do this. So would you do it? That questioning of this group a little bit differently, a different kind of relationship with patients that is relying not so much on the knowledge and that experience, and sometimes that professional responsibility that people don't necessarily recognize. In some cases, support workforce has that requirement, in other cases not. So I guess I would just say, right, it cuts across, and this group does have some unique differences, even though they are equally important in terms of the team and their vulnerabilities.
Thank you so much, Susan. To emphasize the importance of the support workforce, as you mentioned, that is actually working together with pharmacists in the different practices, which is very relevant, all the issues that you also mentioned. And now, Safi, you represent here the early career members of FIP, a diverse group of people, extremely enthusiastic. Now, they are representing here different practice settings, but also a sort of a couple of generations, depending on the definition of generations. So how do you see that? How youngsters, how young members of the profession, of scientists also and educators see this issue of vaccinations, and especially doing what we have gone through during the pandemic?
Thanks, Luis, for giving me the floor. So as you have mentioned, we're representing early career pharmaceutical group of FIP is representing not only the young pharmacists, but also the early career pharmaceutical scientists and the students. So I would like to start first by stating that vaccination of pharmacy workforce in all sorts of pharmaceutical practices is very relevant, and that we all know that immunization is essential to preventing the spread of contagious diseases, especially we have experienced it just in very close history, moving just out of the COVID pandemic. And our panelist colleagues have raised very valid points that we as the early career pharmacists and pharmaceutical scientists can agree on definitely. Giving another perspective from the early career practice and educational aspect, going back to the pharmacy schools, not too long ago, everything has drastically transformed and became digitalized, and the lectures of pharmacy students and pharmaceutical scientist students have all held online, and applied laboratory practices where they had to be online as well, and hybrid. So up to some context worldwide not long ago. And until most of the communities have been vaccinated, and the students and the lecturers as well, the face-to-face education could not commence. So here we can clearly see and understand the relevancy and the importance and the vitality of the vaccination. Last but not least, I would like to stress on the vital role of early career pharmacists and pharmaceutical scientists that have been the bridge basically between all of the healthcare professionals and the younger generation of the community in promoting of the vaccines and immunization, in decreasing the vaccine hesitancy in the community.
Thank you, Safi. Very interesting perspective in a way that if you want to approach a certain generation or certain group of people who probably are younger, maybe it'll feel more empathic or will feel the message differently if it comes from a healthcare profession that in a way is in the same age, or at least they feel in some way related, which is a very interesting perspective. Thank you. So we have finished the turn around all our participants, but I would like to raise a question because we have seen Ruben sharing with us what has been done so far by FIP regarding this topic of vaccination. We are actually now still learning a little bit about what went on during the pandemic. So the question is now, what can we, FIP, what can the professions that all of you here represent can do a bit further? Do you need more policy? Do you need more education? Do you need more one-to-one approach? Of course, I will rely a lot on your own perspective. Of course, we are all biased here because we all have our settings, but what's the next step? We are all aware we have different perspectives. We come to the same stage or to the same level. So what's the next step? What can be done? And maybe I'll just follow the same order that I started with. So Jaime, the floor is yours.
Yeah,
what's the next step?
Thank you, Luis. I'm thinking as a community pharmacies being a vital part of the primary healthcare workforce. And I think we can all agree that the same vaccines that apply to other primary healthcare workforce apply to pharmacists and their teams. But there are other vaccines that might be more related to providing services. Now, I'm going to explain myself. Yeah. So, for example, TB, which is not common to be provided to adults. There's not much evidence about its efficacy, but I think that's vital if community pharmacists want to provide TB-related services, maybe adherence, screening, also to HIV patients. And that's something that maybe can be stated by the FIP, that importance in terms of facilitating the access to those services. I think that's pretty important. Also, the being a highly vaccinated workforce speaks on behalf of the profession when asking to be able to vaccinate to patients. How can we be asking to vaccinate people if the rate of vaccination in the community pharmacy workforce is not high enough? That speaks about us, and I think that there should be some messages sent by FIP to member organizations and individual pharmacists about the importance of being vaccinated in that utilizing that vaccination coverage to ease the access to providing new services in pharmacies. Also, we have had some experiences in Spain and Europe about how to ease that process of being able to vaccinate in our pharmacies, which is not always an easy process. But I think that first thing, being able to allow pharmacists vaccinate pharmacists is a very important stage. And you can either do that in for example, in the premises of member organizations that can provide a centralized setting where to vaccinate the community pharmacy workforce. That has worked well in some experiences I've participated at, and especially be able to have pharmacy teams being vaccinated in pharmacies first prior to be able to vaccinate regular patients. So I think that in terms of being able to ease the access to vaccinating in pharmacies might be important. Also, raising the importance of vaccines in general, especially the vaccine coverage in CPD materials and events that we have today. So I think that FIP can have an important role in that sense, making it a little bit more complex, or providing it an utility to reach more and to do more. That's what I think.
Thank you so much, Jaime, for your input. Ryan, what are your thoughts?
Yeah, so I definitely would agree with Jaime on the role that FIP can have in increasing access to pharmacists as vaccinators and pharmacy support staff as vaccinators, and helping to advocate for that globally, because I think when pharmacy can do those vaccinations, anecdotally I believe that you have a higher likelihood that even those resistant individuals will start to be worn down. It's kind of like if I buy a piece of carrot cake and I put it in my kitchen, it keeps staring at me over and over again until I eat it. Whereas if it's in the bakery, it doesn't get eaten. Maybe that's not a good analogy. I just wanted to talk about carrot cake. But I think the other thing that FIP can do to help with this is really to provide both quantitative and qualitative examples. I think that's where, as healthcare professionals, we look to what other practices are and to learn and grow from that. So, understanding if we talk about mandating of vaccines, what vaccines are mandated, where, how many different institutions, countries, etc., and is there anything that we can use to help support advocacy efforts towards mandating certain vaccines? And then, from a qualitative standpoint, it's really those stories, kind of what we're doing here today about what I did on my summer vacation to get people vaccinated, that help spark ideas to personalize, customize, localize different activities. Because at the end of the day, I mean, you do these big, you can have big mass vaccination events, you can have large vaccination policies in place, but where it really comes down to eventually is that individual one-on-one interaction that you have. And I think that's where some of that qualitative story sharing from FIP and FIP members globally really can help and does help.
Thank you, Ryan. I'll keep that idea of the cake. I think it's very valuable. I think I'll always do the copyright. No worries. I'll mention that was here, so I have some people who can attest for that. But thank you, Jerry. There's a lot being done by FIP just to help our colleagues that are working in emergency and catastrophe situations. So, what more can be done, either by the section or by central services, or as a whole, as a board, or as a mixture of different constituencies within FIP?
Definitely want to piggyback what Jaime and Ryan shared, and to also emphasize partnerships. And the reason why, or should I say, building up coalitions. As an example, it's amazing to me that there's still incredible amount of resistance, even in the US, from various different medical groups, telling pharmacists, no, you're just not qualified. You're just not good enough to this and that. Even though the amount of training that we receive, the amount of care that we provide for our patients, you're just not good enough. So I think, just put it on a global perspective, I think it's incredible. It would do a great amount of service if FIP can advocate, obviously, not only our behalf, but also to build coalition with various different stakeholders and partners, showcasing the incredible amount of training that we have done, the amount of care that we have done for our patients. I think that would go a very, very long way. And I want to emphasize on that point. Thank you.
Thanks so much, Sherry. Just also to share with all of you, FIP has been doing that. It has been starting that work, and I have to be honest. In a couple of probably in 1 hour, we'll have a meeting of this policy committee on the role of pharmacists in live course vaccinations. So I'm also chairing together with Ronald Goose that group. So I'm just taking some information for what is going to be discussed. So it is a very timely webinar, which was not planned, which is good. But thank you for sharing this idea of coalition, and also to emphasize that the reluctancy of involving pharmacists and other support teams in other issues that are not regular, like vaccination, because you still have a lot of jurisdictions we don't allow vaccines to be administered by pharmacists. But this perspective, even in the US, that we know sometimes you can see as a gold standard for a lot of issues, that reluctancy still exists. So the importance of having this policy and advocacy behind all of this and supported by FIP. But of course, to have policy, we need to have data, we need to have knowledge. So Filipa, what else can be done on that regard, or on other topics that we think is relevant on behalf of FIP?
Yeah, so I think there are three things that should be done. One is there's still much work to be done on improving access to technologies, well, to vaccines in particular. Many people don't get vaccinated because they don't want to, but there are many more who don't get vaccinated because they don't have access to vaccines. And for me, this is perhaps or the most important issue. And I think FIP can definitely have a role here. And very much related to this, policy and advocacy, which has been mentioned, but I'll give you a specific example. So the general epidemiology that we have been observing is that pathogens combine. So more and more we have combined vaccines being administered everywhere. And currently, after the pandemic, COVID vaccines started to be administered, co-administered with influenza vaccines. And this approach has been used by many countries, perhaps not all, but also not for all groups. So, for example, I am not a pharmacist, I am a pharmaceutical scientist. And this means that if I go to have my COVID vaccine in my country, Portugal, I will only have the COVID vaccine, but I will not be entitled to receive the influenza vaccine. And I believe if FIP represents also pharmaceutical scientists, then definitely there's a role to play here. I guess technicians, I'm not sure, but I'll let the colleague Susan talk about that. My final point is about education. I think education is crucial. So, of course, passing on evidence-based information to demystify much of the misinformation that's going on. But it should be twofold. On one side, provide detailed education and training to all FIP members, but at the same time to have the ability to communicate in a simple way. And I guess the early career pharmacists will also think about this, but I look at my daughters, they don't read long texts, they like images. So there should be a stronger work on conveying information in a simple way that young people read, not only young, also old, because they're getting short-sighted. But so information is not just about complex education and training, but also about the ability to communicate and reach everyone in a tailored way.
Thank you so much, Felipe. Actually, we're replacing myself, which is great. So giving a lot of topics to the rest of the presenters. So thank you for that. That was not arranged either. So but thank you. This perspective of that we are practitioners, but you also have other colleagues that are working in different areas, and they also need to have this perspective of they all contribute to the awareness of vaccination. And you mentioned again a very important point, and it's mentioned I think in most of the issues like the education and academia. So Mansi, what's the next step? What can you do more?
I'd like to state here, taking on from what Jaime, Ryan, Philippa, and Jerry said, we have a BPP project where the academic section and the community section are working with the Indian Pharmaceutical Association, where we are developing the curriculum and training for pharmacists to be vaccinators in India for the first time. We are at the first phase of training, which is planned for May, and significant work is being done on that. And this is something that can be replicated by others. We are looking at an FIP accreditation that we are working on. And this is what is going to probably lead us to the advocacy bit of things that we need to work on. And as pharmacists will start vaccinating, we have taken on the train the trainer approach, where because in India and in multiple countries, I do not know about all of the situation globally, but there is significant variability in the degrees of education, training, and competencies and skills in the pharmacy workforce. And this often leads to lack of skills for evidence-based critical appraisal as well. So appropriate verbal and non-verbal communication would be the best way forward. And like Philippa just mentioned, something simple, we have just initiated work on a pictogram project in India that I'm doing with some students, because that will enables simplifying. People do not, this generation or quite a few people globally do not necessarily have the time or wish to read everything. A picturesque memory works quite often, and we are working towards that. In addition to that, what the FIP is doing in India at present is a big step for identifying a role that pharmacists have in immunization. And this is just one of the services that it will lead pharmacists to provide. Because we do not have significant opportunities in India, but because we've started with curriculum and training, and we are adapting it to the Indian scenario, we are working with the University of Sydney, with FIP, the Pharmacy Council of India. And this is, when I say we, it's the community pharmacy and the academic pharmacy working together. So collaboration across borders, across sections within FIP is, I think, making great steps to take the pharmacy profession and students of tomorrow, who are going to be pharmacists of tomorrow, whether they are pharmaceutical scientists, or practicing pharmacists or educators, I think they are all going to work towards more of practice implementation eventually. That is what we are all aiming for patient care. And thus it is equally important that what is being done is significant. And the only thing is, I would like to say there should be more from FIP that we can do to improve advocacy globally. There should be probably some work that is done within FIP, which could be better implemented beyond training and implementation of a particular project. So that is what I think is the next step for FIP to look at. Thank you.
Thank you so much, Nancy, not only to share this fruitful collaboration within the Board of Pharmaceutical Practice between academic pharmacy section and the community pharmacy section. Very much looking forward to see the results as a way, as a sort of a role model can be used in other projects. And also this last point that you mentioned, you're actually challenging FIP to say, what can we do more as well? So this perspective of personal responsibility as well, because you know that all of us, our responsibility, all stakeholders, but we have an individual responsibility towards all of this. Thank you so much, Messi, for your feedback. Sola, so I'll give you the floor to you. What more can be done? Have you thought about this?
Yes, I mean, since the conversation started, I have. Yes, and vaccines are a peculiar kind of medicines. Because if you use it and it doesn't work well, if you use it and you don't catch the disease, it doesn't mean that it has worked. If you use it and you catch the disease, it doesn't mean that it didn't work, okay? So communicating that kind of nuance to the public, where you have an army of cynics out there, is I think is a job for professionals, okay? And one experience that industry has, and some of our colleagues have really been at the forefront of this, is communication, okay? They communicate to sell their products, they communicate to end users about safe use, and a lot of other things. You find them in medical affairs, you find them in marketing, you find them in sales, and those kind of functions. So they've developed experience with communicating very, very nuanced information. And it brings to mind, what Ryan said about storytelling. We can't communicate the same way we communicate other things, that the benefits are so obvious. And of course, it speaks to what Jerry mentioned about collaboration and coalition. There is a lot of resource within industry that can help with communicating the benefit of vaccination, even to doubters. And I know we walk a thin line, between embracing industry and keeping our not-for-profit status. But I think what we should do more is walking that thin line in such a way that we can exploit the resources that is in industry to communicate the benefits of vaccination. Thank you.
Thank you, Sola. Thank you for that availability to emphasize this availability of interaction between professionals. So in a way, the role that our colleagues in industry can provide on that, on all of the support. Thank you so much. And I give the floor now to Susan. While there's been raising a lot of issues, while PTAC has been doing an amazing job, this interaction within the structure of FIP and so on and so forth. So what can we do more, either on PTAC, on FIP, on a regular basis, on a daily practice?
Thanks so much. And exactly what we're starting to do and continuing, and today is a great example. The inclusion of the pharmacy technician and support workforce in the dialogue is critical. And we're not nearly where we need to be in terms of open dialogue and recognition of the importance of this workforce as a part of the team, a different part of the team clearly, but one that is there to be a partner, to collaborate, and to enhance the capacity of the profession as a whole, and not a group to be considered in any way a concern to hold back, but to actually invite and to make sure that they are a part of the conversation, and that we can identify those very important components that they bring. And that can look very different depending, again, on the situation, the location where that is, what the health system looks like, the education opportunities for this group. Their competencies are really diverse. So that's certainly one of the things that the PTAC is working on. One of our current and very important projects is to define the competency framework for this particular group and to understand what that looks like. It's a challenge because we know that it is so diverse across the world, and we will have to define that, what it looks like, very differently. I reflect on Jerry's comment, and I think for people to recognize that the concerns that pharmacists talk about so often in terms of their peers on the health team with physicians, medicine, recognizing the value of pharmacists. For many pharmacy technicians, they have that same concern about their own peers within the profession. Our pharmacists likewise recognizing what they do bring to the table, what they have to offer, and to do that in a way that is not at all territorial about who does what. That plays out same dynamics between pharmacists and pharmacy technicians, and I think we need to talk about that and allow those conversations. So the advocacy, Felipe, you talked about those individuals that may not be considered in recognizing that they have the same opportunities, the same supports. Are they included in receiving the vaccinations themselves? And that is something that, again, we recognize not across the board. They will not be recognized as equally valued and able to access some of those things as well. So everything that way that others are saying is absolutely true. And I think the biggest thing for the pharmacy technician group is the dialogue, and then also continuing to do the work on understanding what are the different roles, and then what are the education and resources that are needed for those different roles across the various geographic regions. So we have lots of work to do, and it really mirrors all of the work that everybody else has talked about.
Thank you so much, Susan. I had a small issue, technical issue, so I missed part of your feedback. Thank you so much for that. And then at the end, I'll give the feedback to Safi now. I'll give the floor to Safi.
Thanks, Luis. So already my colleagues have highlighted very important topics, and I wish to add in my input focusing on my country, to Cyprus. And here, as well as some of the countries, pharmacists are not authorized as vaccinators, and the pharmacy curriculum in the universities is lacking the students' training in delivering the vaccines. So this might be a way to explore FIP via the AIM, the academic institutional membership, to collaborate with the FIP member organizations and the FIP AIM member universities and the institutions to take the lead and help complete the needs and programs to create or develop for certifications for pharmacists as vaccinators. And with the help of this, we can always work together with the member organizations, and early career pharmacists can be involved in communicating and advocating further to change or upgrade already existing policies, and also to advocate for the pharmacists as vaccinators. Also hearing from Mansi, the work of Indian Pharmacist Association and the sections involved definitely needs to be highlighted and shown as a role model for the other organizations. One of the best ways is also to convince the governments in changing existing policies is real life examples from other countries with well-developed systems in those particular areas. So it would be really good in a way of FIP to again be the leader in advancing pharmacy in this way, to help in other member organizations, maybe also via the help of the Global Pharmaceutical Observatory, the GPO project, to focus on this area and share the information with member organizations and involve them in creating the policies.
Thank you so much, Safi. So in a way we covered, well, I just want to keep, just 1 or 2 sentences for each one of your feedback. So Jaime, focus on the expansion of the number of vaccines available in the community, for instance, to get more people or more pharmacists and support workforce involved. Ryan, focus on the importance of having a global perspective. Jerry, on the creation of coalitions. Then Felipe mentioned also the fact that we are an international federation, not only focusing on practice, but also with pharmaceutical sciences educators could actually have the same status regarding access to vaccination. Then Mansi mentioned the BPV project under the lead of CPS and ACP, and the importance of collaboration. And then Sola, the importance of communication within our own profession. Susan, the importance of dialogue within all the one that's working on the same practice. Then Safi, this idea of sharing experiences from jurisdictions or countries that have different experiences on this regard. And we know by experience that we all have a different level of development, and it's not saying that one country is better than the other. The experiences are different, the regulations are different, so we all have something to learn from each other. While this discussion is very, very fruitful, I've been seeing also the Q&A, and I presume that most of the answers have been covered by the feedback by our presenters. And I just would like to give 30 seconds to each one of you just to say a final thought, a final word, and then we'll move forward to a couple of announcements and a wrap up. So Jaime, I'll start with you.
Yeah, pharmacists need to be vaccinated to really show how they care for the people we serve. It's paramount.
Being an example, thank you. Ryan?
Yeah, I just want to reiterate the role that we have in helping to educate and dispel misinformation and keep ourselves educated and be the examples that Jaime talked about. It's fundamental and critical to the safety of our patients, beyond just vaccinations for COVID and influenza, but all types of vaccinations.
Thank you. Thank you so much. Jerry?
Just want to emphasize that we have a huge role to play as health educators. I think health literacy is huge, and we learned quite a bit from COVID, that it is paramount that we provide health literacy to our patient populations and at large.
Education. Thank you so much. Filipa?
Yeah, I'll just remember that vaccines are the most effective intervention in public health developed. So obviously, all pharmacists and pharmaceutical scientists should support it, provide the example, and support information about its use.
Of course, the use of evidence. So keep it. Thank you so much. Mansi?
I'd like to say that all pharmacists should be vaccinated and should be actually advocating for immunization, be it from students to early career and advanced pharmacists, irrespective of whether they are in practice or in different workplaces. Thank you.
Thank you so much. Sola?
Yes, I think a lot of the points have been made, but we shouldn't forget about our place in healthcare. We're the most accessible, and we should exploit that to better the healthcare situation in our countries by communicating, by educating, and most important of all, by serving as good example.
Being leading by example. Thank you so much, Sola. Susan?
Certainly, I think the importance of recognizing that the support workforce is a member of the team. They are an extension, and very importantly, so likewise, they also need to be vaccinated, as pharmacists do, for all the same reasons recognized. And I think just finally to say that they are a group of individuals that have such enormous capacity to enhance the services that are available. They play a critical role in terms of the concerns that we have across the globe for our human health resource and shortages of those individuals. This is a very important group that can ensure greater access for the public.
Partnership. Thank you so much, Susan. Safi?
So I would like to highlight with my last words that it is really important to collaborate with each other interprofessionally and with the profession itself, involving early career pharmacists and pharmaceutical scientists in the decision making and giving the input from younger generation's perspective and making use of the late career pharmacists and pharmaceutical scientists' experiences and harmonizing everything and working together to achieving the goals that we set to advance the pharmacy and of course the improvement of the pharmacists' roles as vaccinators and advocating for immunization.
That's a wrap. Thank you so much, Safi. So just to share with all of you, you have roughly 130 participants. So roughly 50% of everyone which has registered, which is average. It's a good evidence. So it's good. So thank you all of you just to be part of this event. And I will just ask for, just to have the next slide. Well, as a sort of a wrap up, we kept actually going through all of them. But just to emphasize a couple of things, I've mentioned a sentence or a phrase for the participation at the end of this, what should be the next steps. But just to remind all of you that we focus on the importance of protecting ourselves, our families, and our communities, to learn as well from the experience of COVID when we discussed about this awareness that people should have an extra shot or not, the idea that we're working in different practice areas and need to be aware of that because sometimes the healthcare issues are different, the importance of evaluation of evidence, of having knowledge, which is the cornerstone of our practice, also the importance of having the academics involved in the experience that we're seeing worldwide and some projects being done together, this idea that we should lead by example. If you are producing a vaccine, or if you are dispensing a vaccine, if you trust it, you should take it. So in a way, you show that you trust on that. So it's a way of promoting vaccination. This idea as well that we are working with other healthcare professionals, this idea of having an interprofessional perspective and to involve everyone on the dialogue is not only important to us to advocate having pharmacists, for instance, at the table to discuss, but also we should be ones to lead by example, also starting inviting like we did today with Susan representing the support workforce to be in discussion that we have within the profession. And this idea that we have, we are actually living in a brand new world, although it has never stopped. It's always a brand new world when compared to what happened 2 months ago, the digitalization, this bridge between healthcare professionals. And again, I hope that all of you, although we might work in different areas and different practices, you got inspired, you got some extra information that will help you just to move forward with this agenda of the profession to have more people vaccinated and to avoid disease. And as mentioned, Philippa, it's evidence. While we can't actually have any argument as evidence. And now we just move forward to a couple of announcements because, as you know, we're going to have our world. So you can also have access to this event, as I mentioned at the beginning during the housekeeping slide. You can access it on the events.fip.org. And then, as you know, we will have our annual event, our annual Congress in Brisbane, Australia. And so we have a couple of deadlines on the of use for all of you. We have the deadline of 1st of May for the abstract submission. And then you have an early bird registration deadline. That's the June 15th. So do not waste any more time. Do your maths, do your planning for pre or post Congress events. We try not to have any sort of events besides the Congress during the actual Congress, but just to remind all of you that you're very much welcome just to participate in our events one way or the other. And I would like to have just a final word of thank you. Oh, sorry, I forgot to mention the Pharmacy Education Journal, which is it's a full open access publication that is run by FIP. So all of you who are interested, just please log in and have a look at the journal. And then at the end, I'd just like to thank all the support team that we have today. So mostly, or namely, Marianne and Gonçalo Souza Pinto, who have been working on the shadows. So everything just runs smoothly. So thank you so much on my behalf and all the participants. I hope all of you have enjoyed this event, and I'm very much looking forward to see you all either virtually or live, and feel free to reach us if FIP can be of any assistance. So thank you so much.
Yeah, thank you. Bye-bye.
Thank you.